From VOA Learning English, this is Health. More than 5,000 members of the Pakistani security forces have been killed fighting terrorists and militants since 2001. Twice as many regular and paramilitary troops have been wounded. But the high number of deaths and injuries has resulted in improved care at the Army's top rehabilitation center in Rawalpindi. Doctors at the rehabilitation center help injured troops regain physical and mental skills damaged in war. Aman Ullah lost both of his legs more than a year ago while serving in the Khyber tribal area on the border with Afghanistan. The 23-year-old is one of the thousands of Pakistani soldiers dealing with wounds from Pakistan's fight against militant groups. Most soldiers are wounded by improvised explosive devices, or IEDs. The soldiers are recovering from major medical operations at Rawalpindi's Armed Forces Institute for Rehabilitation Medicine, or AFIRM. Aman Ullah and several other soldiers are now hoping to compete in the next Paralympic Games. This international competition is for athletes with disabilities. The chief of the rehabilitation center says he is proud of the progress made in treating the patients. The experience of treating thousands of patients over the years has led to improved medical practices. These improvements include more useful artificial limbs to replace arms and legs lost to injuries. Medical workers have also developed other improved practices for helping wounded soldiers. There are plans to expand the Rawalpindi Rehabilitation Center. For VOA Learning English, I'm Carolyn Prasuti.
From VOA Learning English, this is the Health Report. Malaria kills about 200,000 newborn babies and 10,000 new mothers every year. Most of these deaths are in Africa. Malaria can also cause mothers to lose their babies before they are born, or cause a baby to be born early. There are low-cost ways to prevent malaria infections, but a new study finds that many pregnant women do not receive these interventions. For example, the World Health Organization has advised pregnant women in areas with high rates of malaria to sleep under bed nets treated with insecticide. The WHO also advises them to get what is known as intermittent preventive treatment, or IPT. This treatment involves taking a low-cost anti-malaria drug at certain times in their pregnancy in an effort to prevent the disease. The WHO recommends that pregnant women receive the medicine during visits to a clinic. Many pregnant women and new mothers go to medical clinics in sub-Saharan Africa. Yet researchers say only about 21% receive intermittent preventive treatment during their pregnancy, and less than 40% are given protective bed nets. Jenny Hill from the Liverpool School of Tropical Medicine is program manager for a research partnership called the Malaria and Pregnancy Consortium. Ms. Hill says a review of 98 studies found a number of barriers to malaria prevention. These include unclear policy and guidance from government and healthcare officials. Other problems include drug shortages, a lack of clean water, and confusion about how to administer IPT. Ms. Hill says countries can save lives by following the WHO policy on intermittent preventive treatment. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. A debate has continued for years in the United States about sports-related brain injuries, or concussions. Conflicting studies add fuel to arguments on both sides. Now, the U.S. president has stepped into the middle of the dispute. Barack Obama held an informational meeting about the subject on May 29th at the White House. He gathered representatives of professional sports groups, coaches, parents, young athletes, and medical professionals to discuss the issue. The sport of American football is often at the center of the concussion debate, but a high school soccer player opened the meeting. Tori Bellucci is a skilled athlete, but she had to reject a college scholarship to play soccer after experiencing 5 concussions. Mr. Obama told the gathering that Tori's story showed that concussions were not just a football issue. He said, parents across the U.S. are having troubling talks about the risks of concussions. Mr. Obama noted that sports-related head injuries are increasing each year among young people. He suggested that one reason for the rise could be better identification of the injury. He said parents, teachers, and coaches now better recognize the signs, including lack of balance, unclear thinking and eyesight, and head pain. Mr. Obama said he does not want young people to avoid sports. Instead, he called for more research. The president announced a joint effort from the National Collegiate Athletic Association and the Department of Defense. He said the $30 million project will carry out the widest study ever of concussions. For VOA Learning English, I'm Carla Babb.
From VOA Learning English, this is the Health Report. Most people in developed countries have no problems getting prescription eyeglasses. They go to an ophthalmologist, a trained specialist who treats problems and diseases of the eye. They may receive a prescription, which gives the patient permission to buy and use eyeglasses. But in poor countries like Rwanda, it may take a lot more time, effort, and money. Rwanda has only 14 ophthalmologists to serve the country's 11 million people. But now a British-based group is helping up to 1 million Rwandans with poor eyesight. The group is called Vision for a Nation. It will soon start testing new eyeglasses that wearers can adjust or change to improve their eyesight. James Chen set up Vision for a Nation. He says Rwanda is one nation where there is a great need for the glasses, especially among school children. Most of the Rwandans need simple reading glasses. They also might be able to use adjustable glasses. James Chen is the founder of the eyewear manufacturer AdLens. The company produces two kinds of special adjustable glasses. Mr. Chen says they are easy to use and have a wide range of magnifications, which makes something look bigger. He says his company has two kinds of technologies for adjustable glasses. Thanks to the World Bank, Rwandans will pay only about $1.50 for these glasses. But that amount is still about 3 days' wages in their country. Vision for a Nation might also provide a similar service in other countries. For VOA Learning English, I'm Alex Villarreal. From VOA Learning English, this is the Health Report. International health officials say the number of new Ebola cases in West Africa is falling. But the experts warn this news must not slow the fight against Ebola. The United Nations is still calling for more international help to fight the deadly virus. In late October, officials in West Africa began reporting some good news in the battle against Ebola. The number of new cases is dropping. In Liberia's capital, Anthony Banbury is the UN official responsible for emergency Ebola response efforts. He confirmed there have been improvements in the fight against the deadly disease. Fewer people are getting infected and fewer are dying from it. But he warns the fight against Ebola is far from over. In the United States, health officials have expressed hope that a new vaccine may protect against Ebola. The disease has already killed about 5,000 people and infected close to 14,000 others. Lausanne University Hospital in Switzerland began testing the vaccine on healthy volunteers. A doctor who only gave her name as Tina agreed to take part in the study. She says a safe vaccine that works is needed to prevent the spread of Ebola. If the vaccine proves effective, researchers will organize tests with larger groups. French researchers are developing an Ebola test that would give results in 15 minutes. The current test used for Ebola takes 24 hours. Faster tests also are being developed in Japan and the United States. President Barack Obama asked the U.S. Congress to provide $4.5 billion for an immediate response to the deadly disease. He also asked for $1.5 billion in emergency backup money. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Hundreds of thousands of children become infected with the AIDS virus every year. These boys and girls are born to mothers who have HIV, the human immunodeficiency virus. The children become infected during pregnancy or from breastfeeding. Recently, scientists identified a protein in breast milk that suppresses the virus. Now, experts say the discovery could lead to new ways to protect babies whose mothers are infected with HIV. Doctors have reduced the number of infections by giving antiretroviral drugs to both mothers and their babies. But experts say that even without anti-AIDS drugs, only a small percentage of babies become infected through breast milk. Sally Permar is a professor of pediatrics and immunology at Duke University in North Carolina. She says infected women who breastfeed can expose babies to the virus repeatedly. Yet, only 10% of those babies will become infected. Professor Permar led an effort to identify a substance in breast milk that may protect babies from infection. Her team studied a protein called tenascin C, also called TNC. It is known to be involved in the process of healing wounds. The researchers exposed the TNC protein from breast milk of uninfected women to HIV. The protein linked up to the virus and made it harmless. Professor Permar and her team suggest that TNC could be used where costly drug treatments are not available. She suggests that this natural part of human milk could be given to babies before breastfeeding to provide more protection. The team reported its findings in the journal Proceedings of the National Academy of Sciences. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. Is chocolate good for our health, or does it just taste good? Many experts warn that the sugar in chocolate is not good for us. But doctors say there are also healthful substances in chocolate, like antioxidants. Some experts say uncooked, pure chocolate may contain just the right balance. The biggest value in eating cocoa and dark chocolate may be their ability to lower blood pressure. This comes from the experience of cocoa butter melting in your mouth. That happy feeling may also add to chocolate's antidepressant qualities, says Kim Hoffman. Ms. Hoffman is a dietitian, a person who advises people about healthy eating. She says the phenethylamines in dark chocolate make us feel better. Phenethylamines are also naturally produced by the brain. She says they create a happy feeling. But not all chocolate is equal. The process of producing chocolate affects its health benefits. The heat required to process most chocolate can be as high as 130 degrees centigrade. Some researchers say such high temperatures can actually lower the effectiveness of chocolate's healthful chemicals. Business owner Anthony Grid makes chocolate at his store in Cape Town, South Africa. He keeps the temperature of his uncooked chocolate below 42 degrees. He says many food experts support lower cooking temperatures. Chocolate makers can also decrease healthfulness by adding sugar to cocoa. That reduces the amount of the antioxidant polyphenol in cocoa. And as food science writer Leonie Jobert notes, sugar is connected to weight-related disease. For VOA Learning English, I'm Carolyn Presutti.